Good morning, everyone. We'll get started in just a few minutes. If you wouldn't mind just popping your name and the practice that you're representing into the chat, that'd be great. Thank you. Gina, do you need me to run the presentation or are you going to do it?
I'm good.
Okay, great.
Everyone can see that. Just looking around to see if Pierre is joining because she's up first. So if she's here yet.
Using my data.
Renee, what do you think? We give 2 more minutes for Pierre to join and then.
Yeah, I think that's fine. And while we're waiting for our first presenter to join, I'll just welcome everyone. Welcome to our quarterly AHP Practice Managers meeting. Thank you for giving us your time this morning. I ask again for anyone who's joined since I last made this announcement to please add your name and your practice to the chat so we have a record of your attendance. And I want to say welcome to some new folks joining us. There is Lisa Gotsis is the new CEO over at Elmwood Pediatric Group. So we welcome Lisa to our group this morning. Thank you for joining us today, Lisa. Looking forward to.
Thank you for having me. It's my 6th day, so I'm excited to.
All right. Yeah, there's Pierre right now. Okay, great. Yeah, you still got that high pro glow, Lisa, so we can tell you're new on the job. So keep that smile going.
Thank you.
I want to welcome back to our group. Oh, I'm sorry, I'm getting distracted here. I want to just welcome back to our group someone who used to be with us. And that's Sabrina McClough, who is has now joined Internal Medicine of Brighton. And Sabrina used to be part of our practice managers group when she was with Valley View Family Medicine. So Sabrina, we're glad to have you back in AHP, glad to have you back in the practice managers meeting. Looking forward to seeing you very soon. So I will shut up with my welcomes now and turn it over to Gina to run us through our agenda and introduce our first speaker. And I'll take care of letting folks in the room, Gina, while you're doing that.
Thank you. So as Renee said, good morning, welcome, thanks for coming. So today we've got a lot of little administrative things to talk through. I'll make you guys aware of as we wrap up the year. This is our last practice managers meeting of 2022. So we're going to make sure that we get all that information out to you before everyone starts taking their holidays. First up, we have Pierre Inglace from GCH Medical Staff Services Office, and she's just going to be talking through her role, what she does there, how you guys can contact her, and then I'll follow up with a little bit about why that's important for AHP as well. So I'll turn it over to Pierre.
Hi, good morning, everyone, and happy holidays to everyone. So I want to tell you a little bit about my role. and what I do and how we might be able to collaborate and partner on any community providers that need to be credentialed here at Strong Hospital and who also will require a faculty appointment. And let me tell you a little bit about what I do. So I work for the Department of Pediatrics. I've been in pediatrics for, it'll be 17 years in February, which I can't believe it. When I first started in peds, my boys were 4 and 2. Now they are, I have my oldest son is a junior in college, and my youngest started at Fisher this year. So time flies when you're having fun. So one of the things that I do is I work with the community practices, and I need to get my name out there because what has happened from time to time, and by the time I get a call, I sometimes have a practice manager or a physician who's actually very frustrated, who has been transferred to many different areas before they get to me. So I want to try and make this process as easy for them and painless, and to let them know there is someone here to help them and guide them through the process. So if your office, your practice has a new provider who's starting, who needs to be credentialed, who needs hospital privileges with pediatrics, they can contact me and I can guide them through that process. Credentialing plus a faculty appointment can take a provider about 4 to 6 months, depending on how quickly they complete their paperwork and submit it back to our medical staff office, and whatever else might be missing for that provider. And usually I'm the liaison between our office and the medical staff office, and really just guiding and making sure that everything is happening on time. And one of the first thing, I've created an intake sheet as well for the practices so that they can go through it and see exactly what I'm going to need to make sure that this is happening, and that we have all of the pieces needed for the provider to get credentialed. Are there any questions at this time? I know I'm rambling, so I just wanna, if anyone has any questions, let me know. There is someone to guide you through the process, and that's what I want to do. I want to make sure that everyone knows that we do have a process and that I am your contact for the practice offices for credentialing and for faculty appointment if your providers need hospital privileges. So really on that note, that's pretty much what I do in a nutshell. I see in the community and private offices. We have probably another 300 provider offices that also have privileges here. So there's a lot going on. It's really busy. And we really just want to work and collaborate with the practices and partner with you for any concerns that you might have, or guidance on questions, or any issues whatsoever that your practice might have. Is everyone on this call from a private practice or from a community office?
Most folks are, but there are also participants who are, with Thompson Hospital or Geneva General. But there are a lot
Okay.
of community practices too, and a lot of peds on our call.
Okay, great. Awesome. Hi, everyone.
You
So,
do have a shout out in the chat, Piera. Ashley Soldi from Fairport Pediatrics says you are wonderful. So you've already got an
thank you.
endorsement.
Thanks, Ashley. So if there's not any other questions, I really, again, feel free to call me anytime. If there's a concern or anything you want to, LJ, there you are. I see you. If there's anything I can do for you or be of assistance, please, just reach out anytime. And also it's not in this, on this page that I see right now, but I also want to provide you with my cell number because sometimes I work remotely. So I want everyone to have my cell as well to contact me as easy as possible and reach me.
Kara, if you put it in the chat or email me, I can make sure I drop it onto this slide before we send it out.
Sure.
So this is LJ Shipley. And yes, Piera, I put my hand up because I wanted you to know I was here, and I wanted to give a shout out to Piera as well and an announcement to this team. So I know personally from Piera helping me for years with my reappointments and all of my credentialing stuff when I was at Panorama. And also she's the first person that I turn to when questions come from your teams of premier providers. And I'm grateful for that. And that kind of service orientation that Piera has had and the personal touch of that is something the Department of Pediatrics now is getting ready to formalize even more. And so I just wanted this team to know some of your pediatricians had heard as well. Dr. Brophy has approved launching an Office of Community Pediatrics, an Office of Community Practice. Sorry about that. In January 2023, we'll begin that work. And so Piera is a central point of that for this type of connection around things that are important for your providers in terms of their reappointments, their credentialing, but also we're going to formalize an advisory council with pediatricians and family physicians and others who care for children. This is a virtual. Technically, we're looking at this as a virtual office, but there will be a home base. I don't know where the physical home base will be yet, to Erica's question, but you'll be hearing more and more about this, but a lot of the development of this is going to be informed by you and your teams. We want this to be really an effective and partnered effort. It will also give an opportunity for our clinical providers to have more direct conduit for conversation and problem solving and interaction around the patient handoffs from the outpatient space into the inpatient space, right? Or with specialists. We've needed that for a long time. And so there will be a full court press on developing this over this year. But I just wanted to say Piera's work really has been, sort of when we think about how do we build out what is working well, we have to streamline the lines of communication, the ways of getting to people. So like, I love Piera giving her cell phone, but we'll formalize this, even more. So Piera, thank you so much for all that you do. And we'll look forward to sharing more with you all in 2023.
Thanks, LJ. Looking forward to it.
Okay, well, thank you both, Piera. So really the reason that, Piera and I had a chat this summer, and we ended up realizing that it was hard for providers to get in touch with the medical staff office and figure out exactly what was needed for some of those new providers coming on board. And AHP definitely has skin in the game on this one, because if you are, aware, you should all be aware, as a provider within the AHP network, you do have to hold medical staff privileges at one of the hospitals in our system. And for pediatrics, that's GCH. So if you have providers who are joining, it's important that you get this process started with Piera and you can get through that so that it doesn't impact your ability to, stay in network, and for those providers who are joining to participate. So as I mentioned, I will drop Piera's cell phone number into this slide before I send it out today. But Piera, thank you so much for joining. Before she leaves, does anyone have any questions? Okay. If not,
I have a question.
Oh, go ahead, Colleen.
Just just know, do the providers who are credentialed at GCH, do they have access to Epic? Like, would they be able to go on e-records and read notes? Or is that, 'cause I feel like some providers don't have, some providers do have access, some providers don't. And oftentimes, our offices don't always receive certain notes. So I was just wondering, is that something that they could help with, or if that's something that I guess, yeah, wondering.
I can, oh, go ahead, Pierre. Do you want to
Oh,
answer that?
Yeah, I was just gonna say, yes, Colleen, your providers can have view access in regards to that, in regards to Epic. They will have to go through training if they have never used it, but yes, they can have access to it.
Colleen, that's the
Okay.
ePartner access, and that's something that's been available to providers all along, but it is a decision on the part of the provider if they would do the training, to do the training and then to log on to access.
Okay, thank you.
But Pierre, that's something that you could assist with connecting a new provider with?
Absolutely.
Awesome. Well, we will keep it moving then. Pierre, thank you again so much for joining this morning.
Great. Thank you, guys. Looking forward to making connections and answering any questions that we can for you, and wishing everyone a wonderful holiday season.
All right, so up next, we've just got a little bit about our AHP Pharmacy Roadshow. I thought I saw Bob join, but I don't think I did, so I will talk through what is going on with AHP Pharmacy. You may have seen in previous issues of Network News that Bob Adams, our Director of Pharmacy Services, is actually on a bit of a roadshow. So he is reaching out to practices to connect with them and just give an overview of exactly what the AHP Pharmacy team has to offer. Bob is not only embedded with AHP Pharmacy, but he does work with URMC Pharmacy as well. So he's going over kind of the complete package of what the pharmacy services look like. In that, we also want to call attention to Pharmacy Pearls, which is one of our most liked, read, newsletters that we put out there. And so he's really looking to answer some of the questions. What are your providers in need of in terms of pharmacy, understanding what your patient's pharmacy needs are, and are there any critical medication issues? You've likely seen that we put out a couple pearls on medication shortages out in the community. So how you can kind of navigate those. He's also wanting to make sure that people are aware of some of these UR community pharmacies that they have access to. If you're in the Rochester community, you may have heard about the Walgreens in the 19th Ward that closed down. So kind of finding ways to collaborate with providers out in that area to make sure that pharmacy needs are still being met. And then there's also your specialty pharmacy. So any of those specialty services that you might need for patients who have cardiology issues, dermatology issues, ENT, fertility, all those types of needs, the pharmacy team is willing and able to assist with in the specialty pharmacy area. So you will get all of this information as well when it goes out with all of the emails and contact information, but we just wanted to make sure that you are aware of that. Additionally, there's the UR Home Care Pharmacy Services. That is a service that Bob Adams has said is not highly utilized, but he does want people to, be aware that it's existing and available to folks. So again, all of this information will be going out in the slides today. But the big thing is Bob wants to make sure that you have a chance to chat with him. If you're interested in Bob Adams stopping by your office or having a conversation with you, you can definitely reach out to his admin, Melissa Schneider, at her email address to kind of coordinate that process. And Bob will be happy to reach out to you. Renee, is there anything on pharmacy here that you think I'm missing on the roadshow?
I think the only thing that I would add, thank you for covering that, Jane. I'm not sure what happened to Bob this morning. Appreciate you covering that material. The one thing that I would add is that you've certainly seen that a lot of our pharmacy pearls and a lot of the pharmacy content and the work in this space has really been focused on care for adults. But I'm happy to say that, Bob is very aware of the need for some consulting resources for our providers who care for children. And I think the most recent Pharmacy Pearl was actually relevant to the PED space about the shortages of liquid amoxicillin and Adderall. So with LJ's help and with the feedback from our pediatric providers, we're raising the consciousness in our pharmacy team of what the needs are in pharmacy for our providers who care for children. And it's definitely becoming an increasing focus. So we hope that you're going to see more and more resources and assistance coming out of Bob's team for our pediatric providers. So keep the feedback coming about what your needs are and what your patients' needs are. And we hope to have some pharmacy offerings that will really serve the entire network and not just be relevant to adult care.
And that's a good point, Renee, that I didn't point out. One of the, I think one of the nicest things about the pharmacy team is that they are able to help with complex medication management and consults. So there is an email address, AHP pharmacist@urmc.com, which is on the slide as well. And that's really a place where any of our providers can, tap into the pharmacy team if you don't have them embedded at your office and say, hey, I've got this patient who is dealing with this and I need to prescribe another thing, but I'm not sure how they may interact or how to titrate or anything like that. And they're an incredible resource that way. So make sure you utilize the service.
Hey, Jana, can I address the question that came up in the chat from Erica? Wondering about if there's any insight on the shortage of amoxicillin. There actually is a Pharmacy Pearl that was released in response to questions from the community providers. I think it was November 20th, 21st, something like that. I don't know if
Weeks.
Yeah, it is actually on there right now. It's very much I'd say it's a dynamic situation right now in terms of the amoxicillin shortage. So they did list, working in concert with community pharmacies and UR Pharmacy, what types of preparations would be more readily available and what your alternatives could be. It's really expected to continue for the next few months, and then hopefully we'll be out of that mess. And there also were ones that were put out about ibuprofen shortage. I'm just trying to think of, there were a couple of other things. So I can go find that, queue it up in the chat, just for a link for easy access if that's helpful.
We can also send it out with the slides.
Yeah.
Even better.
Absolutely.
Okay, Erica, so the pearls do go out, and this is something that we may need to think about too. The pearls normally go out to the providers directly in a constant contact email, but they are living, in perpetuity on our website under the Pharmacy Pearl section. Erica, I'm going to also send that link directly to you after we end today. That way you'll have a way to put that in there. You're welcome. Okay. Any other questions on pharmacy? Comments? Once, twice? Okay. So next up, we've got our provider engagement report. You guys have likely heard Renee and I chatting about this for quite some time this year, and we are happy to have this here and be able to provide some updates. So I'll start with just a quick overview of the PER. Really, the PER is the tool that's going to enable us to measure and inform you guys on how providers are doing within the new PCP reward plan. That is new for 2022. And although we've experienced some delays, we've made you guys aware that we're not going to hold you, we're not going to hold you to the quality for this year because we haven't been able to provide you good access to data and your performance. So beginning in 2023, with the use of the PER and the new reward plan, we're hoping that we'll be able to provide this information to you guys. It's going to give a snapshot on the quality and total spend of each provider and also demonstrate how your progress is going towards the incentive. In previous iterations of our reward plan and performance data, we haven't been able to show how you're doing underneath all of the incentive components that AHP utilizes. So you've always had insight into quality, but now this will give you insight into your IPCs, cost saving initiatives, and things of that sort. And if you're in any of those pharmacy initiatives, medication switches. LARC is one for this year, depression screening follow-up. You'll have more insight into those types of things. This is going to be distributed electronically up on the Tableau. And so we've been doing trainings this year. We've completed, I think, 3 already. We've gathered that information for PER users who are going to be utilizing the PER through practice username spreadsheets, and we've worked with practice managers and physicians on getting that information. We do have all of the recordings for the PER trainings that we've held already up on our YouTube channel. That's a great place to start if you are, interested in, getting onto the PER. You already have your username, but you haven't been able to attend a training yet. And you can't attend the next training that we have on December 13th at 12. So hitting the YouTube channel is going to be a really great place to start if you fall into that category. I just want to talk a little bit about the next training on the 13th. Before this meeting, right before this meeting, I had a chance to talk to Christy Howd, our Director of Information Management, and she let us know that they're, testing out some changes and that there may be a chance for an upgraded dashboard at our next training on the 13th. So that's really exciting news. The entire team's been doing some really incredible work on that. So I'm excited for you guys to see the most recent, version that we have for you all. So I just want to talk a little bit about that PER onboarding. As I said, we have requested that username information, and all users, even if you already have a university guest account, have to go through this guest account process. That's because the licenses are distributed and securities are distributed in kind of a siloed fashion. So if you have security to one aspect so let's say ePartner, that doesn't necessarily apply to the PER. So we want to make sure that if something were to happen and your ePartner were termed, you would still have access to the PER and vice versa. So it's really 3 steps. You verify your identity, and you'll get your username and password if you don't already have one. And then we'll add the security to your PER, your new guest account, or to your old guest account. It's really a simple process, but it does require that we work together in a timely fashion. Cherie Turpin has been leading that. And so if you have not yet received information about getting a PER username or password or anything like that, and you have questions, you can email myself or Renee, and we'll get you connected to Cherie. There was a brief hold in mid-November on licenses because we've had a lot of interest in the PER, so we had to purchase more licenses. Glad to let people know that that's been rectified. We have all the licenses that we need to accommodate the interested users, and Cherie and Christy have been hard at work adding those securities and getting those issued out to folks. So you should be getting information about that if you haven't already. So just a quick look at what some of those updated features are in the PER. What Christy is hoping to be able to test is actually some of the drill down information in the pharmacy widget here on the home screen. And then in future iterations, you'll also be able to see information about pediatric LARC. So that will show, have you completed a training? And then as that progresses, it'll also show you, how are you doing in terms of placement for each of the providers at the practice. There's also going to be the citizenship component. That's going to show you how you're doing in terms of things like coming to one of these practice managers meetings, joining an advisory council meeting. And that shows you citizenship at both the provider level and the practice level. We've talked a little bit about what that means. You can earn citizenship, which is 10% of the reward plan on practice level activities. So if practice managers meetings are attended or some of those other boxes are ticked, then every provider at the practice earns that incentive. If that doesn't happen, then you can, each individual provider has the option to earn that incentive at the practice level. That is what I have on PER. I want to give Renee a chance to add anything I may have missed. And then for you guys to ask any questions that you might have about where we are with PER as we wrap up the year.
I don't think you missed anything, Jana, but I would add on just to remind folks that, the whole point of accessing the PER, of monitoring the PER, is to have the opportunity all along the year to optimize your incentives and optimize your performance that optimizes those incentives. Those folks hopefully remember that for 2022 quality performance, we're going to hold providers harmless. We recognize that the PER wasn't implemented in time to be a useful tool for that very purpose. A lot of the reason why the PER wasn't implemented in time were related to those Arcadia data issues that are no surprise to anyone on this call that we've been experiencing in 2022. So folks are going to be held harmless. But for 2023, we have every expectation that the PER is going to be fully implemented throughout the network, that our Arcadia data issues are going to be resolved, and that this will be a helpful tool for either providers to log into or the folks at a practice who are accountable for quality performance. We recognize that in some of our practices, like for example, we've got some folks from the Thompson family practices. Their individual physicians may not be interested in logging into the PER, but the quality folks who work in the quality department are going to want to be able to log in, identify opportunities for improvement, drill into the data to see which gaps require being closed. So the PER really will work for any kind of practice model. So just that reminder that for 22, you're held harmless. For 23, we're certainly expecting that everything's going to be working well, and we will resume quality performance accountability. And then because Jana mentioned that the pediatric LARC initiative is going to be visible on the PER coming soon, it seems only right to remind folks that tonight is the second session of the reproductive health training that's available to our providers. It's free training. It's at 5:30 tonight. Email me if you need the link to register your providers or would wish to attend yourself. And the attendance at the LARC training will count for a citizenship, satisfy the citizenship component for a provider. So
Renee,
that was it.
Can I just add to folks that Rachel Phelps, who's the expert, she really is a national expert, but we're lucky that we have her here in Rochester, who's delivering this talk. This is a talk that's really foundational. It is for your providers to be completely up to speed on the evidence behind, the evidence behind offering patient-centered reproductive health counseling. This is all about the counseling and the information, and then opportunities for you to think about how to reduce barriers to access to LARC. So this is not a training to place. It's a Zoom session with a Q&A that follows. The one that was held just about 3 weeks ago was so well received. I've never seen comments like this come back on a talk. Like every person was able to talk about what they learned in that space, and it's for all providers, because LARC access is critical for our adolescents. But honestly, we're doing a nice job with that. It's even more critical for adult women, and women and persons. And so I just would really encourage your providers to join. It is a very well spent hour and 15 minutes this evening. So thanks for that plug, Renee.
And just a reminder too, if you did attend the training in November, this is identical to that. So you do not need to attend both of them to get the full experience. If you did it in November, you've got what you're going to get tonight as well. So.
Not to gild the lily, we do though have folks who attended in November who liked it so much
They want to come back.
it again.
I know they want to hear it again. It's just great. I mean, it's entertaining and it's really good information. So we're really proud to be able to offer that space for Rachel to talk to our teams. Thanks.
Awesome. So at this point, I think Renee is going to take it away and walk us through some upcoming and recent payments.
Okay, thank you, Jana. Next slide, please. So this is just a reminder of what's been hitting your bank accounts or what will be hitting your bank accounts soon. So the second quarter 2022 clinical integration, those payments were just issued the week of November 13th. Very sorry on how late those are reaching you. This, clinical integration for folks who are new to AHP or new to this call, it's just a quick primer on what those payments are. That is the dollar per member that AHP passes through to our provider. So for your every attributed Excellus or MVP member attributed to your providers, you receive $1 per member per month, and we pay that out on a quarterly basis. We receive the money from the payers. So if we don't have the cash from the payers to pay you, that delays our ability to pay you. And that explains why we are getting out the second quarter of 22 out in the fourth quarter of 22. Thankfully, we don't anticipate quite as egregious a delay for the Q3 payment, and we're expecting to be able to put those out the week of December 19th. And as you know, we alert you to these payments via email to tell you that the payment has been made electronically to your account, and we include that payment detail that lays out per provider how much of that payment can be attributed to each individual provider in the network. If you have any questions about that, just feel free to reach out to Jana or to myself. And before I go to the next topic, just a quick reminder, please make sure that you've entered your name and your practice in the chat. Next slide, please, or the next two. Okay, great. 2023 employer contracts. I like it this time of year just to give folks a quick run through of those plans that are contracted with AHP to be the tier 1 network for their employee health plans, just to make you aware of any major changes to those health plans. So for the purpose of reminding you, our 3 health plan contracts with which we are contracted are the FF Thompson Health Plan, the Highland Hospital Health Plan, and the U of R Health Plan. And for each of these plans, what they all have in common, AHP is the tier 1 network. And when those health plan members obtain care from an AHP provider, their out-of-pocket expenses are lower. Next slide, please. So great news for the changes to the 2023 FF Thompson Health Plan. There are none. But for the purposes of just a quick review of that health plan, this is about 1,500 members. Their TPA or third-party administrator is Excellus. They have only 2 plans, which we call fondly the high deductible plan and the higher deductible plan. Both plans are HSA eligible. There's 3 tiers of benefits, no PCP required, preventive care covered at 100%, whether it's an AHP provider or just a provider who's in Excellus, but not in AHP. And this plan seeds their members' HSA accounts. So single folks covered under a single plan, FF Thompson deposits $500 into their HSA account. And for employees covered under a family plan, FF Thompson deposits $1,000 into their HSA account. Interesting, I've learned, is that this employer is considering, and other employers around the country, this is new to me as a new move in the HSA coverage world, is rather than just making a flat contribution to an HSA, employers are now taking a look at the benefits of a matching program for HSA contributions. So to encourage employees to make their own contributions that are then matched by the employer. So that will be interesting to see if that impacts any of our health plans that are contracted with AHP. But I first learned about this from Thompson and their benefits consultant, talking about this as a new trend in employer health plans, is matching HSA contributions. Next slide, please. These are what the Thompson member cards look like. Their prefix is VYA, and of course they only have Excellus as their TPA. And next slide, please. And then just so you understand, these are the levels of their deductibles. So the top level deductible is for a single person, the top level is for the high deductible plan. The second line is for the higher deductible plan. So under tier 1, for a single person, your deductible is $1,400. For a family, tier 1, the deductible is $2,800. Once the deductible has been satisfied, the plan's going to pay 80% and the co-insurance will be 20%. And then you see the rest of the levels there. And all of this information will be provided, and obviously we'll be sending these slides out after the meeting. Next slide, please. 2023 Highland Health Plan, they have had some significant changes. They have eliminated tier 3 benefits for all of their plans. So if you are a Highland Health Plan member and you obtain care from a provider who neither pars with AHP nor with their TPA, and they have MVP and Excellus as their TPA, so you're completely out of network, you're paying for that 100% out of pocket. There are no benefits for out-of-network care. I'm trying to gain some clarity from the plan relative to emergency care obtained from an out-of-network provider, because that just seems kind of extreme to completely eliminate out-of-network care. But that's a big change for 2023, elimination of tier 3 benefits. They've increased their deductibles, they've increased their co-pays, but in a good increase, they have also increased their HSA contributions into their employees' HSA accounts for folks in a lower salary band. So they're making a higher contribution. Highlands also added IMED vision insurance, but their medical plan still has routine eye benefits. So IMED could be considered just like a supplemental routine eye care insurance. Next slide, please. Quick overview of the Highland plan. They have about 3,000 members. As I mentioned, their 2 TPAs are Excellis and MVP. They have 3 different plans. And then you see highlighted in red where there are changes from the prior year. No out-of-network benefits, that's new for all of their plans. And they've increased their employer contributions to $500 and $1,000 for family plans. Those are what the cards look like for MVP. For those that are for Highland Hospital Health Plan members, you see it says Highland Hospital. It's got the name of which plan they're in right under Highland Hospital. And then the next slide shows their Excellis, what their Excellis cards look like, and clearly name the plan as well. Okay.
Hey, Renee, this
Yes.
is Tanya from 12 Corners Pediatrics. Can I ask a quick question?
Oh, of course, please.
So for the Highland Hospital plans, does this mean if a PCP sends their patient's lab, like a strep test or something like that, to an RGH lab instead of a URMC lab, that the patient would have 0 benefits for payment for these, and the patient would have to pay that in full?
No, because the Rochester Regional Lab would be par with MVP and Excellis. So
Okay.
so they would be considered a tier 2 provider, and tier 2 benefits would apply.
Okay. All right. Thank you.
Great question. I really appreciate that question, and I appreciate the efforts of our providers to do their best to steer patients towards their patient referrals towards providers that are tier 1, wherever possible. Patients just don't, we work with patients, or rather we work with these health plan members to try to give them the knowledge they need to advocate for themselves, but it's an ongoing challenge. You all know how it is. The patient expects you at the front desk to tell them what their benefits are, rather than to understand them themselves. But it's the kind of thing that you really only care about when you need it. So, and when they need it is when they're in front of you. So thank you for that question, Tanya. I appreciate it. So for the HSA Saver plan, the tier 1 deductibles went up to $1,500 for single and $3,000 for family. The prior year levels were $1,400 and $2,800. And under this plan, once the deductible is satisfied, the plan is going to pay 90%. If it's tier 2, once the deductible is satisfied, the plan is going to pay 70%. So up until those deductible levels, the health plan member is paying 100% out of pocket until those deductibles are satisfied. Next slide, please. Healthy Basics plan. This is kind of like a combo in that this has a copay once the deductible is satisfied, but those copays have gone up under tier 1. In the prior year, they were $25 and $40, so small increase there. And the deductibles went up as well, about $100 at each level. And again, no tier 3 benefits under this plan. And then the final plan that belongs to Highland, the Healthy Advantage plan, elimination again of those tier 3 benefits. The deductibles went up. This has a copay for tier 1, where day 1, no deductible for tier 1. If for a PCP office visit or a specialist office visit, you're just paying a copay. The deductibles for tier 1 apply to facility visits, labs, urgent care, things like that. And then tier 2, there is a deductible that has to be satisfied, and then the plan will pay 80% and the coinsurance is 20%. These are a lot of 3 plans is kind of a lot for the size of this population, and they have the 2 TPAs, MVP and Excelis. So Highland has a lot going on. And again, all these details will be in what we send out after the meeting. And then finally, to the big one, the U of R health plan. So this is the big one that has about now 35,000 members. And the only real change to this plan is the return of the HSA contributions for the lower salary band. They had been suspended, but they were reinstituted. So if we can go to the next slide. There's only 1 TPA here, Excelis, 2 plans, the PPO and the HSA eligible, and then the change being the reimplementation of the HSA employer contribution, where the U of R will deposit $200 into the HSA for folks covered under a single plan and $400 for folks covered by the family plan if that employee is earning less than $65,000. Okay, those are what the cards look like. These prefixes URL. And yep, go ahead. And no changes here. Same deductible levels, same copay levels for the copay plan. And then next slide for that high HSA eligible or high deductible, same co-insurance levels and same deductibles. So no major changes to the U of R health plan this year. Want to remind folks that if you are having claims issues for your U of R health plan members or Thompson or anyone that we're contracted with, these are some examples of what those might be. You're a tier 1 provider, you're an AHP, but you're seeing that the claims for U of R health plan members, for example, are coming back processing with tier 2 benefits and with a tier 2 patient responsibility, or it's a service that's not tiered under the health plan, but the claim is processing with tier 2 benefits. Those are just some examples of what we've seen. So the next slide is just to advise you of what are some solutions. First of all, to contact the TPA, contact Excelis or contact MVP, depending on the plan, the member's TPA, to confirm the tier 1 status or to confirm that the service isn't tiered. And if the TPA is telling you you're not tier 1, please reach out to Jana or to myself. I've learned something in the recent weeks as some of these issues have come up, which is that when you are calling Excelis or when you are calling MVP about a claims issue for one of these health plans, the folks on the phone are confirming your tier 1 status by looking at AHP's website. They're not even looking at their own system. They're looking at our website. And they're not using our website correctly. They don't understand how the filters work and how to really drill in to find a provider. So hey, no judgment here. We've got some work to do on the website and making that provider search be more user-friendly. You shouldn't have to know how to use a search. So I own that. But all that being said, I just want to let you know this is an issue we're aware of. That we're working on it with the TPAs to advise them, first of all, how to use the website correctly, but also they really ought to be looking at their own system and how a given provider is set up and not depending on an external source for that information. So we're working on that, but just, long story short, if you're having an issue with claims for any of these health plans and you've contacted the TPA and you're not getting any assistance, reach out to us and we will assist you. That's it for the health plan coverage. Are there any questions, issues, problems, anything you want to throw in the chat or take your mic off mute and talk to us about? No? Okay. Well, then I want to facilitate a discussion here, and I hope folks will be willing for this to take off their mute and chat with us, because we want to get some information from you all or some feedback from you on how you are sharing information from these meetings with everyone else in your office. We want to give you the resources you need to amplify the messaging that you're getting here. So, we'd like to know if any of this information that you're hearing in this meeting is worth sharing with your providers. How do you go about sharing what you've learned? For example, we talk about the PER and we talk about the guest account process and what the PER is used for. Are you sharing that with your providers? When we send the follow-up email that includes the slides, or does that format, is it is it easy to pass along? And what kind of information are you not getting in this meeting that you would like to be able to give your providers? We talk a lot with you all about the business of AHP, right? About the payments and the contracts. And we want to make sure that we're giving that information to you in a way that's easy for you to share with your providers. So they as well understand the appropriate level of information about the business and the contracts and the payments. So with that, I'll be quiet and ask if anyone's willing to give us a little feedback on this issue. And take a sip of coffee.
Hi, Renee. It's Chris from Stony Brook.
Thank you, Chris. What's up?
You can hear me okay?
I hear you great.
So we share a lot of that at provider meetings or like full staff if it's something that, the staff have to be more involved in.
Mhm.
But I think the stuff that you send through is really good. It's very helpful.
Thank you for that. Do you feel that that everyone in your organization knows that you belong to AHP?
Oh, yes, absolutely. Yep. Yep, we're very grateful, especially over the last couple of years. And I think that engaged more of the staff to realize who AHP was and what our relationship is with AHP. Definitely.
I appreciate that. Thank you.
Mhm.
Anyone else want to share? Although I certainly appreciate that Chris's experience and Stony Brook's opinion of us is good and you feel well engaged and everyone knows that might not be the experience of everyone else. And we want to hear that. So please share, if you think that's not the case and what ideas you have for making that better. I'd be particularly interested in hearing from folks who are in an employed model, like our friends at Finger Lakes Health or Thompson, where we know there's a little more of an arm's length between the provider and AHP. So we'd love to hear more about how we could close that gap and make our information and our communications more relevant.
Hey, Renee, it's Lynn Walsh from
Hi, Lynn.
Thompson. Hi. So I think the information you give us and the slides are fantastic. And then basically I just kind of break it down to who needs to know what, take those slides and present them at a monthly meeting. We have a monthly meeting for all providers, all secretaries, all nurses. So it gets disseminated to the appropriate group all at once. We also have a bi-weekly care team meeting. So next Thursday, I will be going over the slides with everyone in the care team meeting.
That's great. Thank you for sharing that, Lynn. I appreciate it.
Sure, no problem.
And for those of you that have those type of standing meetings, I appreciate there's probably a ton of information to share for every meeting. But if there's ever a little bit of a lull where you're looking for content, please know that Jana or I are always willing to come and present, to talk about AHP, to talk about what's happening in value-based reimbursement. I find when I do presentations like that for groups, maybe not everything is entirely relevant to the given practice, but everyone in that room is a consumer of healthcare, and generally, finds that information relevant to them as patients and people that are stakeholders in the system. So just want to throw that out there, is that we're happy to come and present. And you could, on any subject that you like. Anyone hearing any complaints about our communications? They come in, there's too many of them, they're not relevant. Who is this AHP person emailing me? We monitor closely our constant contact emails for people unsubscribing, and just curious if there's any feedback on that.
Well, that's nice because we've been working really hard to space out our communications, across the months and the weeks so that people aren't getting spammed with AHP emails for, 4 consecutive days. So if no one's complaining about that, I think that's
That is good to hear, because we have tried. Just ask anyone at AHP who comes knocking on Jane or my door of like, I need to get this out today. Pharmacy Pros just went out, gotta wait a week.
They're a
Of
tough
course, if
wall to
it's-
get through.
Pardon me?
I said they're a tough wall to get through, but very appropriate.
Renee, can I share some
Please.
feedback of mine with our practice? So I have to say the last 2 years have been very crazy. The pandemic sort of threw everyone for a tailspin with a lot of new processes, tons of COVID testing, whether it be sending it out, doing it in-house, e-clairs, expanding. So, we have found that there's been a lot of extra tasks that need to be taken care of, not to mention the fact that for pediatrics, we all stayed open, continued seeing patients, and have had a record high number of patients. So it has certainly not been as easy to find time to communicate with the providers and have routine meetings the way we would really like to. So for my specific workflow, usually after the practice managers meetings, I have a weekly meeting with one of our providers just to go over anything that needs to be discussed. So after a practice managers meeting, I sort of go over any kind of highlights with that particular provider of anything new coming up. And then the doctors kind of, will pop into each other's offices and chat about relevant things here and there. So it's not the best, but that's kind of what we're sort of dealing with now with all of the busyness and all of the extra things. I do have to say that one of our providers has expressed concern lately that they feel that there's information being given to practice managers and with our communication, but not being relayed to them in like their physician meetings with AHP. And I think it's kind of hard for me to know what information is going to them, what information is coming to us, because we're not part of their meetings, we're only part of these meetings. And then when we do try to communicate with the providers about things that are new, if it's something they already know, they're kind of like, yeah, we already know all of that, and they don't want to discuss it because they're very busy. They don't have time to talk about things that they already know. And then if it isn't something that they already know, they are like, well, why is this the first time I'm hearing about this? So I think it's hard for me as a practice manager to know what information is coming to us, what information is going to them. In terms of the follow-up email and the slides, I love it. It is a lot of information when we have these meetings. So it's very helpful to have the slides to refer back to when we are talking to the doctors, because I can just flip through it and, it's all right in front of me. So that's great. I love the communication with AHP. I feel like you guys are a great team. I always find everything to be very clear. But like I said, I think the only thing that would be nice to know is what info is going to them and what info is only coming to us, if any. It's hard for us to know because we don't see both sides of it.
Right. No, that's really helpful feedback. Thank you. And I'll tell you one thing that might be helpful to address this, and Jana has really led the charge on this, was after our PCP advisory meetings, we've created a follow-up email to those attendees to just list in quick bullet points. This is what you heard. This is why it's important. This is who you would need to contact at AHP for more information. We, I believe, do send that to the practice manager as well. And if we're not, we're gonna. I can't remember right now. I'd have to go look through my sent items, but Tanya, I think that would be one solution. So at least the practice manager is getting that same information of like, hey, this is what your guy heard at the PCP advisory committee meeting, both the adult and the pediatric advisory committees. I think that's one way to address that. I hear you with the provider of this is the first I've heard of that. That's, that's the kind of thing of like, well, there's always a first time. Yeah, this is how we've maybe chosen to share it with the providers is saying we're pay practice managers. We're sharing this information with you. Please make the folks in your practice aware as you deem, appropriate. But that feedback is important, and hopefully that follow-up piece after those advisory meetings helps close the loop for the practice manager of knowing what their providers heard there. And then for what you're hearing here, should we be copying your providers on this follow-up email? Should we be doing a recap in network news of what we talked about at the practice managers meeting so providers know to ask you about it?
Renee, it's Karen with Goodman Peds. I definitely do not get anything after the pediatric advisory committee meeting.
Okay.
Yeah, no, we don't.
And I can tell you my providers are not going to want the slides emailed to them. Besides,
Okay.
One of them will bounce, and you know that. So
Right. Okay, I know, I appreciate that, Karen. So you're not getting it on the pediatric side, and we will address that.
And I've seen too, confirmations in the chat to what Tanya is saying. So I agree with LJ and Renee too on this one, that maybe we just start copying in the practice managers on those advisory meetings. The follow-up.
I just wanted to add, I appreciate that feedback a lot, because one of the things we realize is, there's an assumption that what we present in the pediatric or the adult PCP advisory meetings then goes back to all of the providers. And that's a big assumption to make, because I recognize, having attended meetings like that in the past, you may or may not then have a follow-up practice level meeting or partner meeting to be able to bring that information to everyone. So Jana's design of this summary design is awesome. It's exactly what anybody who's busy would want, because she's dropping links in. There are only relevant slides, but it just gives that high level boom, 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 a reminder of what was there, and especially if someone was not able to attend from their practice. But we'll include all of you, because I think you are the ones that are the conduit more often than not to the rest of the practice team, and to all the providers, your nurse practitioners, PAs, your nursing staff. So thank you.
Thank you, LJ, and thank you everyone for participating in this conversation. Very helpful, and giving us some really clear action items to follow up with you. And thank you so much for the comments in the chat. Lisa, I just saw your question about information to share with front desk, receptionists, nurses as to what AHP means to them. That's a resource we could definitely, create, and we'd be happy to take a stab at that. So thank you for putting that need on our radar, Lisa. Okay. Keep feeling free to continue this conversation or comments in the chat. Odetta, you just came off mute. Did you want to add anything?
No, actually, I lost connection and was just coming back in.
Oh, okay. Well, welcome back, Dada. Glad you rejoined us. So I'm gonna move along because we are really out of time. 2023 practice managers meeting schedule. We have our new dates ready to go. So this is when we'll be meeting next year. We're gonna try and keep it to an hour, and this will be sent out in the follow-up. These dates are also all on the calendar on ahpnetwork.com, and I want to really reinforce that message, because I know many mornings, like every time we have one of these meetings, I have to check my email. I have to remind myself to check my email when this meeting begins to see messages from those of you who are desperately looking, where's the link? How do I get into the practice managers meeting? I just want to remind folks that is on our website. So if you're ever trying to join an AHP meeting and wondering, oh God, how do I get in there? Go to our website first, provider resources, calendar, and they'll be right up there, and they do include the Zoom links. So just want to make you aware that you don't have to wait to hear from for me to remember to check my email and look for your messages. So just want to make that plug, but this is the schedule. Of course, we send out invites and we will be looking forward to seeing you again in March. And then just my final reminder to remind everyone in the practice that you are an AHP participating provider and ask that you refer to AHP specialists in hospitals and imaging and labs. And this is our rogues gallery of AHP staff and resources, and all of this information, of course, will be sent out to you after this meeting. I think that's everything I had for the agenda. Jana, LJ, anyone else from the AHP team have anything they want to bring up? Okay.
Nothing for me.
You guys, it's been a hell of a year, man. Thumbs down on 2022. Looking forward to a great 2023. So grateful for your partnership. You are the biggest asset AHP has, and we are grateful for you and your work and the care that you give our patients. And even more so, I mean, let's face it, the care you give me, my family, my neighbors, you know, this work is very personal to me, and I'm grateful. And I know it's all very personal to you too. I'm grateful for all that you do. So have a lovely holiday and a happy new year. Please reach out to us for anything you need. And we look forward to seeing you again in 2023. Have a great rest of your day.
Have a good day, guys.
Thank you, everyone.